Good afternoon, everybody. It's Betsy Connell from MCOA. It is 2 o'clock on Thursday afternoon, and we're glad you're joining us this afternoon. As a reminder, this is a dial-in event only, and the purpose of these calls is for EOEA and MCOA to respond to questions submitted by the network to the coronavirus@mcoaonline.com email. So, David, I'd like to turn it over to you for a couple of opening comments.
Hi, everybody. I'm glad you're able to join us again today. I appreciate
Good afternoon,
the efforts.
David.
Good afternoon, everybody. I'm glad you're able to join us today. I appreciate everybody's efforts over the last week as we try to begin to think about reopening our senior centers. I think the governor has given us some strong advice that we had on Monday. I know we're going to hear from Kelly and Betsy and Betsy and Carol later today about some of those issues, as well as Becky. I appreciate you all taking the time to listen in on this as we begin this next part of our phase. We're going to hear today from Kelly, who will be giving us some information regarding the social distancing, but more importantly, the contact tracing and what that will mean for our network. And I think we have some exciting opportunities with My Senior Center to be able to do that through their system. But we're also going to talk about the beginning plans for reopening. It's not going to be happening next week or the week after, but as we think weeks or maybe a couple of months down the road, we need to think about how our senior centers will look once we begin to reopen. So again, I welcome you to be part of this conversation, to contribute into our coronavirus at mcoa.com website in terms of providing us with what your best practices are, what your plans are. And we hope that we can get you information in return that you find valuable and are able to use on the local level. So I turn it back over to Betsy, who will walk us through the next part of the agenda.
Thank you very much, David. So next we are joined today by our own Susan Karp from MCOA, who's going to provide us with an update on the property tax work-off program. So Susan?
Thank you, Betsy. I was looking for my unmute button, but you're in control. So hello, everyone. And for everyone present, thank you so much for all that you're doing. Before I start with the actual update, I'd like to go over, since this is not a Zoom meeting and I can't ask for hands to be raised, I actually don't know how many communities that are present on this phone call that have the senior work-off program in their community. So I'll start with a very brief background. The Senior Citizen Property Tax Work-Off Abatement Program, and that's a lot of words, which is really otherwise known as the Senior Work-Off Program, is outlined in Mass General Law, Chapter 50, Section 5K. The Tax Work-Off Abatement Law allows cities and towns to establish a program giving property owners 60 years or older the opportunity to volunteer services to the city or town in exchange for a reduction in property tax of up to $1,500. Not all municipalities have adopted this great program for their seniors to participate, allowing a senior to receive a real estate tax abatement. That said, some communities in the Commonwealth have created a hybrid using municipal funds or private donations. So what does the law provide? The law provides municipalities flexibility to underwrite the program, and by that I mean establish income limits designed to meet the needs of the senior population for that community. It provides to establish the number of participants. It could be as little as 5 or 150 or even more. Establish real estate abatement amount. I've seen amounts range from $500 to the maximum allowable by law, which is $1,500. It provides to establish the period of hours that must be worked. Some municipalities use the fiscal year. Some periods cross 2 fiscal years, in which quarter the rebate is applied. It also allows for an approved representative to perform the work for an individual who cannot perform due to health issues. Now, you can Google Senior Work-Off Program in Massachusetts and review communities that have adopted this program along with access to the program descriptions. So I'd like to pause for a moment because I'd really like to extend a thanks to those COAs who've responded to our request this week to let us know how the participants are contributing to the community. And as that list grows, we'll be posting those results. So what do the folks do in the community? Well, positions are at senior centers, schools, public library, town hall, local cable access TV, which is one of my favorites, but most know that, and the recycle center through DPW. Another community, and this has really been through the pandemic, the seniors are making wellness calls. They're helping to assemble program kits. One even calls for bingo now that it's done via phone. Some have been helping with grocery shopping and deliveries. Again, making wellness calls, making masks, and baking. MSC data input is one that a senior work-off individual could do. Those with multiple language can translate at programs, perhaps even on a virtual platform. They can be bus monitors for the recreation departments, possibly when the summer programs return. And I think we can be creative as a group in developing non-contact and safe distancing contact opportunities for these folks as we move forward. So what's happening now to participants with their abatements? Well, some municipalities are waiving the remainder of the hours needed, providing full benefit in terms of a real estate abatement. Some have extended the program period through the end of the calendar year, and some just haven't decided. So please keep us posted on what's happening in your community. So I would like to recap whether you are an existing community with a senior work-off or whether you're new. So again, the Mass General Law is in place to decrease housing insecurity for older adults through the real estate abatement. Municipalities must adopt the law into their bylaws in order to offer the senior work-off program. And don't forget, MGL, Mass General Law, allows a municipality flexibilities in program design while applying those guidelines consistently. So if your community already has the program, you can seek to increase the income limits. You could possibly use the senior circuit breaker income limit, or another tool, you could use the economic index that we see through the UMass Gerontology program. You can seek to increase the number of participants. It's always a good idea to have a wait list, and that supports your need. Increase the abatement to the highest allowable amount of $1,500. Seek to add an approved representative to the program, because oftentimes those who need it the most may be too frail or compromised to work in order to receive the benefit. And actually, the approved representative is one area that is often overlooked, so I encourage you to review your programs. And actually, although this is an assessor's program, as it is technically an abatement of real estate taxes, it's most often managed by none other than councils on aging. And this is yet another very real example of how we as a network contribute to our municipalities through the work performed by the participants and increasing the economic security of our older adults. And of course, I'd be remiss if I didn't highlight that having this program in your community not only reduces economic insecurity for older adults, it reduces isolation, reduces ageism as we highlight the vitality of older adults, and it increases civic engagement. So to all of us, happy Older Americans Month. This, of all years, make your mark. Thanks, Betsy, and back to you.
Thanks so much, Susan. I appreciate that. And lots of good information there, and more will be forthcoming as Susan has just reported on. That information will be shared on our webpage so that you all have access to that. So moving now into the next portion of our program, we have joining us Carol Malone, Assistant Secretary for Elder Affairs, and we have Kelly Driscoll of the COVID-19 Command Center, who's the lead in the contact tracing collaborative. She serves as a liaison to the local boards of health in regards to this. And I think Carol's going to go ahead and speak first a little bit about the governor's reopening plan, and then we will move to talk with Kelly about the importance of contact tracing. Welcome, Carol.
Good afternoon, everyone. Thank you, Betsy. Thank you, David. And thank you, Susan. And welcome all on this gorgeous May, beautiful, sunny Older Americans Month day. Again, it's a pleasure to be here. And I know we have a full agenda. So I'm just going to summarize a couple of things relative to Governor Baker's reopening plan that was announced last Friday on May 18th. I'm sure you have all been reading fast and furious as there is a wealth of information embedded in that plan. And we have lots to think about as we move towards our new normal during this very difficult time. First, I want to say that, as we all know, Massachusetts has been one of the hardest hit states in the United States, with over 86,000 confirmed cases and over 5,700 deaths through just last week, May 18th. And with that and those statistics, it really influences and impacts our overall planning and forces us all to really think about what makes the best sense and what is the most strategic approach, and also keeping our most vulnerable well and safe. Working on the plan, the governor included many various sectors, individuals, employers, health systems, government, you name it. One of the areas that he has kept really at the forefront is that we will not return to a perfect normal until a treatment or a vaccine for COVID-19 is made available. The reopening, as he has shared, is driven by public health data. Massachusetts is a leader in the testing and tracing strategy, and we are very fortunate today to be joined by Kelly Driscoll from the COVID-19 Command Center, who will talk about testing today and the tracing, about contact tracing. The reopening plan continues to fight COVID-19. It doesn't go away as we begin to reopen. He has strongly encouraged and is looking for all of us to do our part around social distancing. He is expecting, and we all should expect one another, to follow and reduce the risk of new COVID-19 transmission by covering our faces with masks, washing our hands, socially distancing, being vigilant for symptoms, and staying at home if we feel sick. And I will add to the piece about covering mask, Governor has made it very clear that the mask is required most times when you're out in public and as you visit certain retail establishments as well as businesses and healthcare facilities, and in those circumstances when you cannot safely socially distance. There is an expectation on businesses. There's guidance provided on the mass.gov reopening site. Mandatory workplace safety standards are in place. There are sector-specific protocols and best practices. In addition, the governor wants all to be mindful of older adults, those over the age of 65 and who have underlying health conditions who are at high risk of COVID-19. Should continue to stay home except for essential errands such as going to the grocery store and to attend to healthcare needs. This needs to be top of mind as we are looking at our overall planning. This will be a phased-in approach. As you know, there are 4 phases. They are not written in stone in the sense that it begins on this date and ends on that date. As the governor has shared, and I've just reiterated, we are looking at the data. We are looking at our experience as we go through these various stages that will help shape the next step as we move along. All of this is, I believe, posted on the MCOA website for your viewing and education. I know there is a lot of questions out there from all of you, and please know that Elder Affairs is with you We are in this together. It has been shared on these calls that a full reopening of senior centers may be in phase 3. It could very well potentially be much later, end of summer, possibly. You should also know that this planning doesn't end with just businesses and our healthcare facilities. We are also, or our private lives, we are also thinking about this at Elder Affairs as we are looking at when will we return to our workspaces? When can we return safely? And it's not going to be anytime soon. There is a lot to plan, a lot to consider around keeping all of us safe. There will be mandatory workplace safety standards in place. And again, this is all on the website, the reopening website, around social distancing, hygiene protocols, staffing and operations, cleaning and disinfecting. There's an attestation. There's a lot to consider and go into the reopening of our spaces to ensure safety as we continue and think about future programming for our older adults. With that, today we are going to hear about contact tracing, as I mentioned. And there's also additional information on the mass.gov DPH website, and I can provide all these links after our call to learn more about contact tracing. Before I turn it over to Kelly, I just want to share, Kelly, and thank you so much for being here, that you are with a network of advocates and professionals in the field of aging. We live our lives around educating and outreaching to older adults and reminding of them how to live independently, how to be safe, to be mindful of scams when someone calls them and wants their personal information, wants to know their Medicare card number or their Social Security or their bank account number. It is ingrained in our education and outreach to ensure that older adults are careful. And during these difficult times, and this is such an uncertain time, scams, we're hearing more and more about them. They're rampant. And many of our older adults are isolated and living alone and don't have someone to act or on their behalf or to check on them or to remind them. So the responsibility is on our aging network to be responsible for that. And as you're talking about the contact tracing and to ensure that we have everyone participate so that we can get this very important information that will help determine the spread of COVID-19, I ask that you have that in mind. And with that, I'm going to turn it over to you, Kelly, for your presentation. Thank you again for being with us today.
Thanks so much, Carol. And thank you to all of you on the phone for what you do. As was mentioned in the previous two presentations, COVID is a scary, hard to get one's hands around disease that impacts vulnerable populations even more than non-vulnerable populations. And we do know that older individuals are more susceptible to the disease, as well as scammers. And that is something that we definitely have been thinking about and trying to mitigate as much as possible. I'm going to walk you guys through a presentation, but before that, I just want to give an overlay of scams. As Carol mentioned, there has been a number of kind of copycat CTCs or contact tracers, and we anticipate there'll be more. And so one thing that we have been very clear about is no contact tracer, whether it's the local board of health or the CTC, will ask for your social security number or health insurance information. We also will not share any immigration status. We won't ask for it, and we won't share it for that type of vulnerable population. That's an important piece of feedback, Carol, and one that we talked about with other phone calls that Elder Affairs has offered for me to present on. And some of the messaging that I forwarded to Robin Lipson in many languages, it does include some notes about what we will be asking for and what we won't be. So with that being said, let's jump into what this is and what we will be asking for. I'm going to attempt to share my screen. Bear with me, please. Great. So the Community Tracing Collaborative was born roughly 2 months ago, and it came out of kind of the initial standing up of the COVID-19 Command Center by the Baker administration on the first day that I was pulled back in to state service to work, which was, I think, the second day of the Command Center being operational. Secretary Sutters and I had a phone call with leaders in local public health, and the first thing that they asked for was support with contact tracing. Local health has done this for ages, for longer than we've been alive, and for longer than many of the people that you guys serve have been alive. It is a pretty old school way of doing public health, and in normal times, when we're dealing with measles, mumps, TB, other sexually transmitted diseases, including HIV/AIDS. This is a function of local health, and you know, when it works well, we don't even know about it. We're not in normal times. We are in a highly contagious disease that can form clusters, that spreads quickly, and can overwhelm our local health system. So as such, we set up the Community Tracing Collaborative, which is an additive system to the work that local health does to collect information about people that are COVID positive, including their contacts, their close contacts, and what, and the, I'm sorry, someone's knocking on my door, to let the contacts know what's going on and that they've been exposed. So I'm gonna dive into a little bit more about what that means, but that's kind of the high level. It's phone calls and it's outreach to check in on folks that are positive and to find out who they may have been in close contact with, so that we can let those contacts know so that they can self-quarantine and hopefully stop the spread on a human-to-human level. Unfortunately, you don't get to see all of these handsome people today, but I did want to leave this slide on because it talks about the different players that are in the CTC. So the Command Center is lead on the CTC, agency head, for lack of a better term, and the technology required, as well as the outreach plans, aligned very well with the experience at the Massachusetts Health Connector, which is the healthcare exchange under the Affordable Care Act, which is run by Luis Gutierrez. He oversees the technological piece as well as some key policy and operational components. Partners in Health is a global leader in global health, and they do contact tracing all over the world. They're best known for their work after the earthquake in Haiti, as well as kind of conquering Ebola in West Africa. But contact tracing actually happens in many countries, mostly non-Western, where infectious disease is more prevalent. And Partners in Health is lending kind of their scientific and medical expertise to how to pull this off. And then the Department of Public Health is a key partner here. Again, this is where the local boards of health have liaised over time on contact tracing. They hold the system of record, which is called MAVEN, the Massachusetts Virtual Epidemiologic Network. And they also are key in advising around how to engage with locals to make sure that all of the work that we're doing is aligned technologically and scientifically. So the goal of this meeting today is to orient the COAs on the entities that comprise the CTC, which I just did, to articulate the role and expectations of community stakeholders and public health leaders in the CTC, to get ideas from you guys about how to engage hard to reach populations, and to respond to questions if there are any. So this is a slide that just shows what is the need for contact tracing. So if you look at the slide on the left, this is the Wuhan experience. So this is based on cases in China, which we know is kind of the oldest data set on COVID. It goes back to early winter. Without any interventions, without any policies, the R naught, or the number of people that will be infected by a single case, was around 3.88. So for every positive case, 3.88 people would be infected. Anything that's above 1 is considered an epidemic. So with significant lockdown alone, so the social distancing that we've undertaken, the R naught came down significantly to 1.25, but it still is above 1. And only with social distancing, adequate testing, contact tracing, and then when people are positive, supports for successful isolation, are we able to bring the R naught below 1. And that's the goal of getting our hands around this disease before we get a vaccine, essentially. And so Massachusetts, took that science to heart and really is approaching this as a comprehensive approach. Our testing and our testing capacity is growing every day, and our plan that we have submitted to the federal government will allow us for much more increased testing, isolation, getting people to stay safely in their home. And if they can't isolate safely in their home because they are homeless or live in a crowded environment, setting up isolation shelters throughout the state. Tracing, which is being in touch with the contacts, making sure they can safely isolate, and finding out who their close contacts are so that we can know. And then supports. Sometimes about 10 to 11% of the times we make this call, we say, can you safely isolate at home? And they say no. If I'm isolating, how am I going to get food or my prescriptions, or I don't feel safe with my intimate partner? And so it's providing those supports that is critical to allowing for the other 3 to occur. In normal times, we kind of call this the safety net. In COVID times, it's really targeted on allowing people to safely isolate and quarantine wherever they feel safe. So the Community Tracing Collaborative has 3 major tiers of people. I think you've read a lot about Partners in Health and the workforce that they've stood up. It's been bumpy. We have had a lot of lessons learned about standing up a 1,600 person workforce in such a short amount of time. And so we are learning as we're going, and in so many ways in COVID, we are flying this plane as we're building it. But when someone interacts with the CTC, the first person that will interact with, if they are a positive case, is called a case investigator. This person will call the positive individual and say, hi, my name is Kelly. You have a COVID positive test results. As a brief aside, the case investigator won't be the first person that tells that person that. Their provider will have already told them. The provider then puts the case into Maven, that system of record I referenced at DPH, and then the case investigator pulls the case through Maven to find out. They will talk about the cases or the positive cases' ability to safely isolate, whether that's doable or not, as well as solicit the contacts that have been in close touch with them up to 2 days prior to symptom onset. Close contact is defined as anyone within 6 feet of you for 15 minutes or more is considered a close contact. I know for myself, and many people, especially during this pandemic when stress is high, but especially among older Americans, memory is a challenge. And so one of the things that I've talked to other the elder affairs community about is how to the relatives or others to have the case identify that director as someone to talk to get information about the person that came with them. What people might they have been in touch with because they sit with them regularly or whatnot. But with regard to the contacts being identified, it does need to be identified by the case, and the CTC can only speak to others if given explicit permission by the case themselves. When the case identifies close contacts, the contact tracer will call those contacts. They will say, You've been in close contact with someone that's COVID positive. Do you have any symptoms? If not, it's okay. Please monitor your symptoms. You should be looking for respiratory stuff, and they'll go through kind of the list. They all have scripts that they're working from, and then they'll say, "I'll call you back in a couple of days to check in." If you have acute respiratory symptoms or anything, please call your provider or go to the hospital, depending on kind of how bad things are. If anyone in the case investigator or contact world can't safely isolate or quarantine or other needs are brought up, there is also a function called the Care Resource Coordinator. And these folks are to kind of link up the individuals with the care and supports that they need. The Care Resource Coordinators are people that either live or work in the towns which they serve or grew up in, so that they kind of understand the community and the culture. As cases continue to go up, I think we'll be noticing a lot of contacts that become cases. Right now, because of social distancing, we're actually encountering far fewer contacts than we had planned for. We thought that every person on average would have about 10, and it's about 2. As the economy is opening up, as Carol walked through a few minutes ago, we anticipate that these contacts will go up and that the kind of level of work will go up. One thing that we have done to prevent scams is we have texted folks in advance of calling and said, "Hi, we're the CTC. We're about to call you about your COVID diagnosis. Please pick up or pick up in 30 minutes or whatever." I know I'm thinking about my grandfather, who I think could get texts on his cell phone, but would have no idea how to open them. We need to be creative for older adults that aren't as tech savvy in this regard. With regard to high priority cases, which I think a number of your members would fall into, just because of their age and perhaps underlying diagnoses, the CTC works directly with the local Board of Health on these cases. So folks might be contacted by the CTC or the local Board of Health. Either way, they won't ask for social security numbers. They won't ask for health insurance information. They will be seeking the close contacts and trying to find out if there's peripheral needs that need to be met for someone to safely isolate and quarantine. So as one might imagine, in 2020 in cell phones, getting people to pick up is the hardest piece. We are trying to use media and get to hard to reach populations, those for which English is not the language of origin, and people that are for various reasons hesitant to engage with the government. But mostly people trust the people that they trust. And so we count on you guys and your colleagues as social resources and stakeholders to be able to start to communicate about what this is and what it isn't, and why it's important. America is just coming around to the importance of contact tracing as a critical piece of getting our hands around contagious disease. And so it's new, and it feels a little bit different than the really advanced medicine that we all are used to at this point in time. But it is critical with a disease like COVID that to help us kind of stop the spread, and especially in vulnerable populations. So with that, I'll stop. I do have a couple minutes, and I'm happy to take questions if you want, or else you can submit your questions in writing to Betsy and we can get back to you.
That's great, Kelly. Thank you. I think it would be really helpful if you can forward to us the slide presentation, and we will post it on our website for the members to view. I do have a follow-up question for you. And this has come up in a couple of meetings with the councils on aging. Many of them have databases of all their participants who come in and out of their senior centers.
Yes.
And, we're wondering, should an individual, either contract COVID who participates there, or you have someone who has been into the center, would the Board of Health be looking to the senior center to work with them in regards to finding out who was in contact
Yeah.
individual based on, the information contained in databases, which is, under Mass General Law is protected information. So I think there's some concerns about that.
Yeah, I think clusters in general are something that we're trying to get our hands around, especially as workplaces open back up. So it's definitely a larger question. And the short answer is, if an individual was like a regular at a senior center and identified the senior center as a place that he or she often frequents, the local board of health would probably go out and do a bit of forensic investigation around close contacts and whatnot. However, in terms of being deemed a close contact in terms of COVID, at this point in time, all close contacts are generated from the Maven case. And so while the local board of health would probably go out and let the senior center know and talk about proper sanitation and kind of what to do now, there would not be kind of a wide-scale permission to tell other people in the senior center that one of their colleagues had COVID. Well, they couldn't say who had COVID. They could post someone that has been here has tested positive for COVID. We're going to be closed for 48 hours to clean and sanitize, and please monitor your symptoms. But they wouldn't be part of kind of the contacts unless they are identified by the case.
Kelly, this
David.
is Dave Stevens again. How are you?
Good.
Thanks again for all the work you guys are doing. We really appreciate this because I think it's important for our network and for the Commonwealth to understand how important specifically contact tracing is. Because again, we're all anticipating that there could be another outbreak later in the year, and that when we don't necessarily want it to expand so quickly that it becomes statewide, we'd like to be able to keep it locally or regionally for those clustered outbreaks, as you referred to before, and try to keep things in a group of people as opposed to having to quarantine the entire state.
Yeah.
But along that line, I just want to make you available. I know that you're somewhat familiar with My Senior Center, and we have another one called Serve Tracker, but for predominantly 75%, 70% of our network has what's called My Senior Center, which is a swipe card like you'd get from CVS or Walgreens or whatever, that you swipe as you walk into the senior center. You punch in which you want to go to the meal, you want to go to the Tai Chi class, you're going over. Way that we trace who is going into what classes. Now, there's 20-25% of the people don't remember to, forget, don't want to, whatever, but it gives us a sense of who's been in the building and to what class. So in terms of next steps, when we look towards senior centers, when we look towards a potential individual who might have gone to a Tai Chi class in November, and that person now is reporting to be positive and starting to show symptoms, that we would have that list in some senior centers of who was in that class, and that might be helpful for your team to expand your contact tracing. So that's what we have to do locally. It's something that helps us report out our statistics to our local. It's how many people are going, how many people come to the senior center. It helps us build program development and evaluation, how many people went to that individual program, that type of stuff. So we have that. That system also has a robocall network system to it. So we can send out a call saying exactly what you articulated there. The senior center is going to be closed for 2 days because someone who was in on Thursday had showed signs of. So those are things that we can put on the table to be helpful back into your network as you try to prevent further outbreaks. So I just wanted to share that with you and recognize that, we would hope that we as a network can stay on top of this because of the vulnerability of our population, and to limit the number of days that we have to keep our centers closed.
Yeah, absolutely. And that's really cool, the swipe card and kind of the tracking of folks. And thank you for letting me know that. I think one of the things is to utilize that technology is the robocalls, but also for other people that might have been in that Tai Chi class with the COVID positive person last week or something, to let them know that they may have been exposed. We wouldn't ever share the name of the person that may have exposed them, but that they should get tested, because really they can only kind of get into this tracing method if they're identified as a contact or if they have a positive test.
And again, I think that's why working with your team as we look towards reopening, we're trying to set up protocols, best practices, et cetera, we would come back to you and say, okay, here's, if this happens, this is what we should do, and if this happens, here are the resources your team needs that we can work together on. And again, as Carol articulated, we're not anticipating this to happen this week or next week. We're anticipating senior centers.
Longer term.
Longer term. So let's get these practices and protocols in place. So at some point in time, we'll circle back to you with a review of what we're beginning to put on paper, and hopefully your team then can augment that with best practices or correct protocols that we can then get out to our members. But I just want everybody on the phone call to understand, and our teams to understand, that we want to work with you, because the most efficient way to keep this virus in check is for us to do the contact tracing and to know who's been in our buildings in case we have another outbreak, to be able to clamp this spread down very quickly.
Thank you. I appreciate that. And I think the folks in the Commonwealth do as well.
Thank you, Kelly, and thank you, David. Kelly, I have one last quick question for you, because I know there were a couple times where your audio dropped out, so I just wanted to clarify.
Oh,
It's okay. So I know initially I heard you saying that the CTCs, when they're reaching out to someone, not be asking for their social security number, correct?
no, there will be no social security number, no health insurance information, no immigration status. That if those come up, it's a scam.
Okay, so your audio just dropped again. I don't know if you could go ahead and repeat.
The CTC or any contact tracer, whether it's the local board of health or the CTC, will never ask for social security numbers, health insurance information, or immigration status.
Great. Thank you. Thank you. I appreciate you clarifying that.
Of course.
And you have that all on a flyer, Kelly, right? There's some type of information circular that we can get out to our members on that.
Yep, I'll get that to you guys.
That's great. Thank you both very much.
Thank you.
We look
Take care, everybody.
Thank you. Take care, and we look forward to posting those slides on our website.
Great.
Thank you, Kelly.
Bye, guys. Thank you.
Bye.
So moving forward, we know that prior to Kelly speaking, Carol was talking about reopening. And we also wanted to provide you all, before we move into questions, we wanted to provide you all with a little update on the MCOA reopening task force. And we're looking at this through the lens of stages, so as not to confuse it with phases, which is, probably important when we think about the use of language. And again, as Carol noted, if you haven't yet looked at the governor's plan, please take time to do that. And as she noted, reopening will be driven by public health data. So we know that people over the age of 65 who have underlying health conditions who are at high risk for COVID-19 should continue to be staying at home now, and that impacts reopening. And I want to share that, this task force and the task force advisory group of COA directors have been reviewing massive amounts of materials in regards to reopening. And along with 3 interns from the UMass School of Public Health and Health Sciences, the task force, with the direction of the advisory group, is crafting guidance for centers and anticipates posting on the MCOA webpage the step 1 considerations after the advisory group meets to conduct their final review next Friday. So I wanted to share a little bit of that with you all, just to give you an idea of some of the components that are contained therein. I'm going to just go through a couple of these. Included in this is developing a communication plan to notify your staff and participants and vendors of your reopening standards and requirements. In terms of social distancing, we recommend that you think about identifying methods that can be used to create that 6-foot social distancing barrier, whether it's the utilization of markings on the floors, signs, installation of Dutch doors, etc. There's many things that can be done. We also suggest consider having staff from your local Board of Health walk through the facility with you relative to making recommendations that may be appropriate in terms of protocols to meet these requirements that the state has put out regarding hygiene protocols and cleaning and disinfecting and maybe even social distancing. Your Board of Health person may have some interesting thoughts and or ideas about that. There's quite a few folks who are walking through this process a little bit already now. And, it came into our mind as we were brainstorming that, we don't know yet if your center or anybody else's center is going to require that all who enter are screened, either by having their temperature taken or, self-reporting. But if that's going to be a requirement, again, this is for you to discuss with your Board of Health, would you need to reevaluate your layout in your reception area if you have one? And would that be the best place for screening to take place? So lots of things, obviously, to be thinking about. And you'd want to determine how you would establish protocols to prevent crowding in certain areas. That might include staggering program start and end times or requiring pre-registration for a limited number of those who can attend. Right? And then you also want to be thinking about what kind of training will be needed for your staff and your volunteers relative to those protocols. So we're seeing light at the end of the tunnel, right? We really do. While the end of that tunnel may seem like it's a fair distance away, we know we will get there. So moving forward through this, we wanted to suggest that you all do the following. And I know some of you have started to do this, but some folks haven't. So we wanted to share this. So be the older adult who's coming into your center. Put that hat on and start walking through your center as the person who is attending, for example, a quilting class or the Zumba class, or that person who comes in just for coffee and a chat with friends. Walk through your center and touch everything, every surface that person will touch or come into contact with. The door handles, the reception desk, perhaps the sewing machine, the craft materials, the exercise mats, etc. Now, doing this will help you to envision and build the plan that you'll need to move towards reopening, as it will help you identify the areas that will require you to put into place these components for social distancing, hygiene, and the cleaning and disinfecting of your center. There will be a substantial amount of detail about this in the Step 1 considerations guidelines, but it's important that you all can see that you have the opportunity to get started now. Becky, I was wondering if you would like to make a comment. Becky is on the task force and has been very, very helpful with this. But, once we get this first guideline posted, you want to share with the network how we want them to respond with their comments and engage.
Thanks, Betsy. Hi, everybody. Becky Moriarty. I'm the director of the Senior Center in Hamden, for those of you that don't know me. We have been working really hard as a team to try to get some guidelines out to you. And as Betsy mentioned, those will be coming. I want you to know that I'm right there on the front lines with you. So in reopening the senior centers, I'm in the same boat. So I'm looking at all of this through through the eyes that you are all looking at it through as well. So once this document comes out to you, it would be really, really helpful for us to get your feedback and know what is happening in your individual town. As Betsy said, there are some towns that are starting the reopening process. That may just be for staff right now. It may be staggered staff. Certainly, we're not expecting that older adults are coming into the buildings yet. But towns are starting to look at these things. And so it would be helpful for us if your town puts out a policy or some sort of document. We would love to have a copy of that so we know what's going on around the state. We can try to incorporate that into some of our guidelines, but also so we don't miss anything. We'd love to know what's going on. So please feel free to send your feedback. You can call me in Hamden if you want to talk or provide any suggestions or recommendations, but we would love to see that. We are working really hard to get this to you as fast as we possibly can. We have a great advisory group that's reviewing things before it's sent out. And certainly we know that we may miss something. So that's where we need all of your help. So again, you can feel free to email me or any one of the members that are on the team, Betsy and Susan C. and Tara. We've all been working really hard. So we look forward to working more with you, but please reach out whenever you need to. We're in it together and we're going to get through it. And I'm doing it in Hamden and I'm doing it right with you across the state. So thanks, Betsy.
Thank you, Becky. Really appreciate that. And we appreciate everything that you're doing to help move forward these different steps as we move towards reopening. It can seem rather daunting, but as we said, if you take that first step, put that hat on, and walk through your center, it really can be an eye-opening experience. But I want to move forward now because I know we have a limited amount of time, but we had a few questions this week, and I wanted to move on to these. So the first area of questions is actually programmatic, and David, this will be for you. It's a follow-up question in regards to the AARP tax prep. So the question was, as a follow-up to the call with Mike Festa a couple of weeks ago, our tax assistance volunteers have not heard anything from AARP. Our local leader said that even if AARP decided to offer assistance in June, our local volunteers are all in high-risk groups, so they would not be able to participate, which of course we understand. Has MCOA or EOEA had any follow-up? If there will not be volunteers, what does AARP want us to tell clients whose appointments were canceled? And can AARP give any recommendations in terms of other resources or courses of action for seniors, particularly those who are not able to afford to have their taxes done privately?
Great question again. The governor's release of his phased-in reopening plan does not have senior centers in the phase 1 or phase 2. So we do not anticipate full opening of senior centers, as you all are aware. Whether there is allowing for limited opening is something that AARP is going to need to work individually with each of you, depending on your town administrator and your local board of health, if that would be allowed. I'm going to ask Mike and his team to join us again next week to answer some of these questions, because we were waiting for the governor's release so they could begin to frame out what's possible and what's doable. At this point in time, I think this particular program is going to be very difficult to pull off for June 1st, and knowing that we have to race through July 15th for our older adults to get their taxes filed is going to be a struggle. But I will defer to AARP Foundation for their complete answer on this, and we'll be asking Mike and his team to join us again next Thursday at the top of the hour, 2 o'clock, to give us an update as to where this stands, since we originally were told June 1st, which would have been the following Monday. So look forward to that particular time.
Thank you, David. The next question we had falls in the bucket of health and safety. And Carol, I'm going to ask this question of you. It was regarding masks. And I believe this question was submitted shortly after we shared with the Councils on Aging all of the information, the great links and the information that DPH had in regard to masks, so that the Councils on Aging can be the focal point for helping to get that information out to older adults in their communities. So the question was, I have a concern and I'm wondering if we could get more information with regards to wearing a mask when exercising, such as riding a bike or walking briskly outside. I see many people, particularly older adults, doing so, and I am concerned about the amount of carbon dioxide they may be breathing back in, and also the temperature, especially as the weather gets warmer. Will you please get some medical input on this so that we can advise properly and hinder any adverse consequences? Many of these people are already walking or exercising more than the 6 feet apart and are often alone.
Thank you for the question. After I saw this question, I thought this is a good one. This is something I've thought about for myself as well. And so I double checked the information that's provided now on the mass.gov DPH wear a mask site. And there's not anything that specifically gets into the medical or science piece of wearing a mask. So I reached out to colleagues and hope to gain some more information in that way. But I thought a little bit more about this and the role you all have, and just thinking about older adults and potentially having underlying health issues. I would strongly recommend, I am a person who exercises daily, and very difficult for me to wear a mask doing certain exercise outside, and I simply cannot. I also have underlying health issues, and this is something I consulted with my own doctor on. And so I think it's important for folks who are in this situation, for older adults who are active and they're out and about and they're trying to maintain social distancing and wearing the mask. I think it's good guidance to check with your doctor until we can get more information around this very concern about breathing in that carbon dioxide and the heat and the warmer weather. It's a great question, and the more that I learn and find out about it, I will certainly share with all of you.
Thank you, Carol. Appreciate that. The next question, I'd say it's the last question that we received for this week, is actually, it's in regard to media. And maybe Carol and David, you both can speak to this. The question is, last week, our local ASAP placed an ad thanking the Councils on Aging and Senior Center for their work. I was touched. I am wondering if either MCOA or EOEA would write an editorial that could be sent to all newspapers in the state documenting the work we are doing during the pandemic. It is good. It seems to be a good time to remind people that we are here and working hard.
David, do you want me to start? Okay, I will. This is Carol, and this is also a good question, and absolutely you should be thanked. And it was very nice to hear that an ASAP was reaching out and thanking you for your great work. Secretary has reached out and asked for all of the good news that you can share with her, so that she can in turn share with Secretary Sutters and Governor Baker. She's particularly mindful of this, and I just want to share that she continually references how amazing and wonderful and fortunate we are to live in a state that is represented across every community by incredible people such as yourself. She did so just this morning on a call that David and I were actually on together. And she often refers to the COAs and the senior centers as the front door. It's the front door, or that point of entry, where an older adult or a family member or a caregiver will knock on, or they'll seek assistance by first coming to the senior center or the Council on Aging. He is truly aware of this and most thankful, and feels that our older and most frailest citizens are well represented, protected, and cared for through all your amazing work. Please continue to share your information with Betsy and David and myself, as we will move that information along. We always want to hear from you. We want your good work shared, and certainly want the governor to know as well.
Thank
Great
you,
question,
David.
as usual, coming from our group. I appreciate it. As Carol did reference, the secretary did bring it up. There was a call earlier today with all the elder care stakeholders, the older adult stakeholders that have been meeting for the last 15 years. But there were 20, 30 people on the call, and she talked specifically about the frontline COAs and what they were accomplishing. So those stories that you are starting to send in are very important, that we can get the word out, as this particular question references. I see it going out on many levels. I appreciate the fact that we should try to do something for the public, and the public should be aware of it, and how we can use the free media to get that done. I think as we see things like the online programming that you guys will be putting on in terms of the cable news access, et cetera, will be showing what the local senior center is still doing. And I think that people should be aware of what's happening out there. I would also suggest that you have individuals who are being assisted by your Council on Aging, put a letter into the editor of the local paper, or to get the word out that way on your Facebook page. Patty has conducted, with Lynn's help, how to augment and what stories you should be putting onto Facebook to be able to increase your visibility of what's going on there as well. And as I mentioned last week and the week before, I'm also collecting those stories because we're going to be giving a legislative update that I'm trying to get out for the June 1st letter. And the June 1st letter is sort of the state of the center, the state of our senior centers in the Commonwealth, with the message that councils on aging have been up and running throughout the virus. Some might have been closed for a short period of time, but there were so many essential services that needed to be done. They most quickly reopened and started helping with a variety of things that were deemed essential that needed to happen and get out to the folks involved. So I just want to make sure that we're getting that word out by getting the word in, which means that you folks have to get the stories into us. Those individual best practices, best stories, human heart stories are there. So telling me what you are actually providing, letting us know what you're doing, completing the online survey that we've set up with UMass Boston, and asked you should have received an email from our team getting you to complete those surveys so we have an understanding of what's going on in the network. All that information comes back to us. We will develop messages on that. We will get it out, not just to the legislature, not just to the administration, but to the public and the consumers as well, because councils on aging are here and will be here to provide the services that we need for older adults, but I can only report on it what I get back from you. So David at MCOA Online, you can send it to me directly. Patty is the person who is collecting all of them and making sure that the EOEA team gets them as well, so you can send them directly to Patty at MCOA Online, and we'll go from there. I turn it back over to Carol and Betsy for closing remarks.
Thank you, David. That would be terrific if you could continue to send that to me, and I just echo everything that you said. We don't know if you don't share it with us, and we want to know. Everybody is caught up in their very busy lives, but oftentimes we just take it for granted, the good work that we're doing. But now's the time to let folks know who you are, what you do, and please know that we are most grateful for your incredible work that you do on behalf of older adults in the Commonwealth. And we want to spread that good word. We absolutely do. You are part of the essential work that is happening every day. And these calls with your questions just confirm that. It's amazing. And I very much appreciate it. And I sound like a broken record, I know, I apologize. But I can't thank you enough. I appreciate these calls weekly. And if there are good things that have come out of, if there's anything that's good that's come out of this horrible situation, this dire situation of COVID-19, I think in many ways it has really brought us closer together. We may not see each other every day or be sitting around a table or driving into work together or touching base at the end of the day or squeezing in a call quickly in between a meeting that we're running to, but I feel that we are so much more connected in a more meaningful way. And it has certainly enriched my work experience and feel much more connected to all of you. And I very much appreciate it. Thank you.
Thank you, Carol. And again, I just want to thank everyone for taking the time to call in today and for the questions that you're submitting and, you know, the participating in the regional meetings. All of this information is so important, and just everything that you're doing. You're amazing human beings, and we're very grateful to you. So I hope that you all have a wonderful long weekend and that you all get rest, which you deserve ad infinitum for all of the work that you're doing. And we will talk with you again next Thursday. Keep those questions coming and have a great weekend. Take care.
Thank you.